so early in the morning and join us. We're grateful for the opportunity to be here and share some of our work that we've been doing around creating new approaches to addressing men's depression and suicide. These are efforts that are part of the Men's Depression and Suicide Network in Canada, and we have 5 members of that network here to present. We have David Cool from Department of Family Practice at UBC, University of British Columbia, Corey McKenzie from Psychology at University of Manitoba, Genevieve Creighton from School of Nursing at UBC, Paul Gross from Department of Family Practice, and my name is John O'Brien. I'm from the Department of Psychiatry at UBC and one of the co-directors of the network, along with John Olive from the School of Nursing at UBC. I'll give you a little bit of a background about where we are coming from before we jump into each of the presentations. We thought we'd give about 20 minutes per presentations with just a couple of moments for clarifying questions at the end of each and reserving general discussion for the end where it might be more meaningful. We're told to disclose our funding, so I'll do so. Our network is funded by Movember Canada. They provided us generous support for developing programs and conducting research evaluation of those programs. So in one way or another, all of us have developed an interest in men's depression and suicide for a variety of reasons, but some of the core issues that have compelled us to do work in this are listed on the screen. Diagnosis of depression in men tends to be fairly low, yet the suicide rates amongst men are quite high, generally 3 to 4 times higher than women. In some male cohorts, it can be up to 8 times higher. Help seeking among men in many contexts is quite low, particularly psychological help seeking, and men also tend to be relatively poor advocates for their health needs. And so this is what really stimulated our interest. And there became an opportunity to further develop our interests and formalize activities through an opportunity created by Movember Canada. Now, if you don't know, how many of you know about Movember? It's a couple. So for those of you who don't, I'll give you just a quick synopsis. This is an organization that started in Australia a number of years ago. It's gone on to different countries. They're a men's health awareness and fundraising organization. Every November, guys are encouraged to grow mustaches as a way, a fun and innovative way to create conversation around men's health topics and also to raise fund and support of addressing those men's health needs. They started with prostate cancer, moved to testicular cancer, and most recently in Canada have moved into the area of men's mental health. In 2013 is when that occurred, and we were fortunate to be amongst the first group of people, I can hear myself differently now, amongst the first group of people who were awarded some funding to get into the area of men's mental health. It was generous funding, $2.9 million. They really put their money where their mouth is when they say we support men's health needs. We put in a proposal to create a network of different organizations. It involves 35 people across 5 different universities and 4 different provinces. And it was a suite of projects, initiatives that we had intended to put forward. You see it here, the Men's Depression website we wanted to create, an Aboriginal men's health program, men's sheds in Canada, it's a worldwide phenomenon, men's transition program, and finally an awareness campaign called Man Up Against Suicide. These are the 5 projects that you'll hear about this morning. Overall, our goal for the network was really to create new places and spaces for men that better meet their mental health needs. And these activities cut across a wide variety, or cut across the health spectrum, in that some of the projects address illness resolution, while others are addressed at prevention and awareness. And they also target different cohorts of men. So some of the projects look at men in general who are dealing with depression, and some are more targeted toward First Nations guys, men with prostate cancer, young college guys, and guys that have had experiences with suicide. And the breadth of these programs really casts a wide net, yet what really pulls the projects together is that they're all focused on better serving the mental health needs of men. So that's a very quick synopsis of what got us here today, and so I'll just jump into what the programs are about. The first one that you'll hear about is the online resource. This is a website that we're working on for men's depression. It's not quite finished yet, so I can't show you the website that we're working on, but I'll give you a little bit of background about the work that we've done thus far. Men, as I alluded to earlier, have a tough time seeking help when they're in need of it, and they also are not so good at illness recognition in many contexts, and depression is one of them. Men don't tend to recognize when they are depressed. Their literacy rates around what depression actually looks like and is, it tends to be rather low. So we're looking at different ways that we can reach out to men and perhaps make some sort of impact on encouraging them to seek help when they need to, and also giving them information about things that they can do on their own. The internet is one potentially useful and effective way of delivering that information. It can reach a wide audience, be accessed anytime. There's typically minimal to no cost. It can be updated as frequently as it needs to be. It's interactive, and it can actually link to other useful resources. We thought that the internet also provides an opportunity to connect with men in a way that sort of maintains their preference for independence and autonomy, and really provides a non-threatening medium through which to actually encourage them to engage in the help-seeking process. Now, we did a little bit of background work to get to a place where we knew exactly how we wanted to develop this website. First, we did an environmental scan, looking out at the internet universe to see what's actually available for guys that are dealing with depression. There's a tremendous amount of literature out there, resources out there. Some of it's very good, but what we found is that there's actually very little that's directly developed for men with depression. A lot of wonderful depression websites, some of which have a subcomponent focused on men, but few of these websites are actually built for men. Then we did an online survey with 200 people, 103 men and 106 women, asking them about what their needs are, what they would like to see in a website, what they wouldn't like to see, and so forth. And then finally we followed up with some stakeholder interviews. These are guys with depression digging deeper into what would be most helpful for them. We learned a number of lessons doing this. First of all, and not surprisingly, men said to us through these different mechanisms that we use to connect with them is that it's really hard for them to reach out to others and seek help. They would prefer to know how to fix things themselves, at least to start. Information overload is a real serious problem with many sites, and arguably with my slides, as you'll see, I tried to pack a lot in. And limited attention and capacity to focus when a guy's not feeling well is really important in order to get the points across clearly and simply. Men told us that they're looking for guidance and direction. The passive information that exists on a lot of the websites say that it's not really helpful to them. They want information about what they can do in different areas of their lives in order to prevent or manage depression. And they suggested that information and guidance are better received when it's known to come from an expert. But personal stories of success are useful to them as a way to keep them inspired. As far as useful information for a website, sleep was by far the thing that was recognized by guys as being most wanted or needed. Ways to improve sleep. Practical tips and action gives little bits that we can use right away to do something for ourselves. Information about depression warning signs. Another big one is types of services and treatment options. What can I actually do to remedy depression? And importantly, how do I navigate the health system? It's one thing to be told what different treatment options are. It's another thing to actually know how to navigate the healthcare system in order to avail yourselves of those treatment options. Another one is getting more involved with social activities. Guys tend to isolate themselves when they're depressed. Many of you guys recognize what they're doing, and so they want help to get more connected to their social connections and relatedly building and maintaining relationships. As far as useful features, local information about local services and healthcare providers, as I mentioned earlier, tools or quizzes to assess their health. They want a quick and easy option to use. It's like, where am I at? Am I depressed? Am I mildly depressed? Am I really depressed? Let me know. Videos to help explain different health strategies. It's one thing to read it, but they said being able to hear somebody quickly, easily describe that, they said, is really important to them. This one was interesting. A way to pledge support or show support for men's depression as a way to advocate for other guys that may be going through things like themselves. Printable action guides with tips about self-care, something that they can print off and have handy wherever they're at to be able to work on things of their own. Articles, and they're supposed to put videos about others' personal success stories, and also blogs with updates about depression-related health strategies. So with this insight in hand for us, we set about developing a website that provides, it says Canadian men, but given it's the internet, anybody can access it, but Movember Canada is supporting Canadian-based initiatives, so that's why I threw it in there. But this is a website that can provide guys with information, some practical tips, and clear guidance for managing and recovering from depression. So some of the key features that we're working on is this information delivery and prompts about behaviors and activities that they can do to make changes in one's life, either on their own or ideally with the support of others. This is done through practical tips and strategies and giving information and advice to guys about how to reach out. That's a big thing. As I mentioned earlier, guys know that they isolate themselves from others, but they know they need to stay connected with them, but they don't know how. It's just safer for them, they feel, to just keep to their own. But as we know, it's really important that not happen. Information about professional services and guidance about how to make use of such services. Another one is information and advice for friends and family of men with depression about what they can do to support the guy in their life that may be struggling with depression. And really, it's a focus on taking action. That's a real big thing. A lot of the resources that are currently available, as I mentioned, really deliver passive information. It's information about the illness, not so much about what you can do to remedy the illness. So some of the guiding principles that we've used to begin developing the website, first and foremost, this is a site for guys about guys. So using guy-friendly language throughout. Being action-oriented. This is something that came through loud and clear when guys were saying what they really needed to see in a website for men's depression. It's been a challenge to strike a balance between providing comprehensive information and being concise. As I mentioned earlier, when you're in a state of mind where it's a bit hard to keep focus, have enough concentration to go through a lot of stuff, you need to get your points across quickly and concisely. And through all of our language that we use, we try to tackle stereotypes and stigma so that guys don't feel alone. It's pretty hard to see the text up here, but this is sort of our internal prototype for developing the website. I'll turn to the next page. You can see we tried to give a comprehensive breadth as far as what the menu options are, some information about what men's depression or depression in men actually looks like, what a road to recovery would be, various practical tips for different areas of a guy's life, how to reach out, Different types of professional services. We have My Action Guide. Here's where they can print their own personalized action guide. Real Stories. This is a collection of videos of personal stories and tips that guys with depression found useful for them when they were going through their recovery. And how to support a man in your life that may be dealing with depression. So this is just one example of what a tip page might look like. The way we thought we would get the information across in a way that resonated with the guys is we would identify some of the core issues that a guy struggles with in different areas of his life when he's depressed. So for example, this one's about food and diet. So some of the key problems that a guy might be faced with when he's depressed. He might be not eating enough, could be eating too much, or simply lacking the motivation even to prepare food. So we put this in the context of questions so that a guy can connect with one of these. He clicks on it, and then there's a variety of tips for him that he can do. And then further along, tips for eating well, healthy patterns. And then you see at the bottom, Guide Food Talk. They click that. There's some videos specific to guys with depression talking about what was useful for them in the context of improving their diet when they were depressed. So that's just an example. We're currently in the midst of engaging with a web developer to make this a professional-looking website. As I said, this is really only our internal working model. It's the first time I personally have been involved in developing a website, and I've been shocked at how difficult and onerous the task is, but I've been learning a lot myself. So that's the first of our projects that are part of our network, developing a men's website. As I said, it's going on, but we're very excited about it. And we see this as really an important tool for responding to men's preferences for self-sufficiency, while still building in messaging to cue them to engage with professional help when it's indicated. We see it kind of as like a laddered approach. They can start with things on their own, but we build in mechanisms, and we actually give them language to be able to connect with other people in their life, to build a team around them for battling depression. So if you are curious about how it's going for us when we do get it, feel free to contact me. There's my information. There's a shameless plug for UBC, our beautiful campus there, and hopefully you can visit Vancouver sometime as well. Thank you. We have a couple of minutes for questions for clarification, or we can wait to the end.
Do you work the younger population, teenagers? Do you have that population in mind when you develop these programs?
So for this website, that was one of the things that we had to address in the way that we cue our language, but also the design and how we deliver the information. So we set it for the 18 to 40-year-old group. It's nothing to say that the information that we have is irrelevant to guys that are younger or older, but because it's not really possible to have one website that appeals to everyone, we had to have a target population, so that was our population. Yes?
You mentioned that they were interested, the focus was interested on prompts. Is there anything built into the website to remind people to do things, like almost like an activity scheduling?
That's one of the things that we've been toying with, and so one of the guys on the team was talking about trying to build an app that paired with this to give guys prompts about that, and it's been useful. The team that we've got is, healthcare professionals, but it also involves guys that have dealt with depression themselves. So that's been tremendously useful to hear what would have been very helpful for them. So yeah, that's one of the things we're trying.
It seems like in the content you're describing, a lot of the elements that want to peer model, or you want to hear other people's
Yep.
stories. And I'm wondering if sort of collaborative thought either in this application or the other things we're going to talk about, a lot of ways that the application could get in touch with other men, peer counseling or peer modeling. Next step.
You'll hear that in some of the other projects because that's exactly the model that they use, and that's one of the ways that we're trying to deliver the information, and it's those videos. That was really important for guys. They wanted to hear other guys that have dealt with depression talk about what worked for them. They want to hear about their journey and their road to recovery, what worked for them, what didn't work for them, because that was a key thing. So we're working hard to deliver that. All right, thank you. I'll turn it over to Paul and his presentation.
Okay, good morning, everyone. It's a delight for me to be here on behalf of the Dudes Club to share with you our story. And give you a bit of an idea first about the context of where I work in Vancouver, and then moving into the story of our Dudes Club, and finally relating to the context of where we work with the network with Movember Canada. So the Dudes Club is situated in Vancouver's downtown Eastside community, which is one of the most impoverished, marginalized communities in Canada. And like any other inner city context, there's a lot of issues revolving around the social determinants of health, so housing, food security, crime rates. And of course, when it comes to health issues, there are major barriers for members of this community accessing needed health resources. So that's the context that we face in the downtown east side. And as an example, when they compare depression rates within Vancouver, the downtown east side, to other better off communities in the city, it's about a 10-fold difference. So there's a huge difference in health outcomes in the downtown east side. And then you compound that with the focus of our program for the lived experience of Indigenous men in Canada, so our First Nations men, who have experienced, of course, of ever-present colonization and the generational trauma that has come over the years that they experience every day. So that affects their ability to access health resources as well, specifically around mental health issues and substance issues. So that's obviously, as you can tell, a very vulnerable population. And it's situated at Vancouver Native Health Society, which is a medical clinic that's been in the community for over 25 years. This is a picture of our annual health fair. So this is our third annual health fair. And you can see the guys assembled in a big circle at the end closing. We had about 130 men attend this health fair last summer for health screening and a big feast, of course. So just to give you an idea, first of all, where the Dudes Club came from and what we do, and then moving on, of course, to our research findings with the project. So the Dudes Club began in August of 2010 when there was a groundswell of community voice and need for men's health services. There's, of course, at that point, a lot of services for women and children for obvious reasons, but very few services dedicated to men, and especially to men for the sake of wellness. A lot of programs for, if you have HIV or hepatitis C or depression, you can walk into a group with that label and talk about how you experience that health issue, but nothing for the sake of all men, for the sake of total wellness. And they were looking for that type of service, of course. And also, as service providers, we had seen too many guys literally sit in a drop-in center at Vancouver Native Health over the years, sipping on coffee and eating their food, and slowly actually dying of AIDS and other medical illnesses without asking for help. So we were obviously tired of seeing that happen. Another inspiring fact was that we wanted to try to bring health to where men feel safe. And as you may notice throughout the talks that we have, and what you've seen in men's health in general, is to switch that paradigm. Because men won't generally come to us. We've got to go to where they are and where they feel safe. And one of the most inspiring examples of that, which some of you may be familiar with, is the Black Barbershop Health Outreach Program, where they screen members of the Black community in barbershops where they may feel most comfortable, men and women for high blood pressure, diabetes, cardiovascular risk mainly. But it's spread to several states, actually got a recommendation by Barack Obama years ago as a model of health engagement. And thirdly, to build on the success of our peer support programs at Vancouver Native Health, which for years have been targeted to HIV, but it specifically, of course, engaging this vulnerable population on an ongoing basis in their health. And finally, we were inspired by Aboriginal women's health research at UBC focused on intimate partner violence. So this 3-year study was looking at why women decide to stay or leave a violent relationship with their male partner. And one of the most consistent findings was that women were asking, where are the men? Obviously, if they're the aggressors, they need help too. So we need to focus services to the men. Now, this Dudes Club has been a community-driven process from the beginning. And along with 2 other patients and an outreach worker, we helped found this program. And the guys wanted to have obviously a foundation and a structure. And one of the most important things for that would be to have some kind of pillar model or a mission statement. They decided to identify 3 important pillars. So the first is to build solidarity and brotherhood. In a community where one of the major issues is actually social isolation and loneliness, this peer support model is a big, big deal for the guys. So if we do nothing else, that's what we do. And the second topic and second pillar is to promote men's health. So through education, dialogue, and health screening clinics, we bring men's health to where the guys normally hang out. And with this important kind of focus on leaving your armor at the door. So as men, regardless of where you come from, we have to wear armor to promote and defend our masculinity. And there are vulnerabilities beneath that armor that we're not willing to expose for most people. But in the Dudes Club, we all leave our armor at the door. So when you walk in the door, you just leave all those issues there. It's a place where you can feel comfortable to share where you're at. And finally, to enable men to regain a sense of pride and fulfillment in their life is a big, big part of our program. So just briefly, there's our website and a logo. So we were lucky enough to have a well-respected native artist from Vancouver Island generate this logo for us. And quickly, the symbolism is 2 sea serpents representing the positive and negative aspects of health. And then the sun in the middle is, in his territory's representation of pure joy. So balancing the things that we face on a daily basis that affect our health and then focusing on attaining some kind of joy. So we thank Fred Anderson for that logo. So what do we do at the Dudes Club? So every second Thursday evening we get together in the drop-in center right beside the clinic at Vancouver Native Health. And the guys meet on a weekly basis for think tanks. So there are about 8 or 10 guys who are part of the conciliary of this group who generate ideas for each meeting, talk about the itinerary, the food they're going to serve, and topics they want to discuss. Of course, we have assignments, so it's allowed us to track attendance statistics over the years. And Henry Charles, who's pictured here, is a very well-respected Musqueam elder in Vancouver, and we're lucky to have him on board with us for the last few years. And he opens every meeting with stories in his traditional language, and then gets the guys engaged with some healthy banter. He spent a long time playing rugby and football for Canada, and has all kinds of stories to share with the guys. And then we play a variety of different activities to engage the guys as well. So poker, bingo, we always have a hockey pool, that's Canada for you. Door prizes, raffles. We have an internet drop-in area. Whatever sports game is on TV is always playing. We have 2 barbers who provide free services as well, so we kind of adopted that barbershop model into our program. And then the health services that we provide are kind of multi-tiered. So we have a street nurse who's been working with us from the very beginning, who can screen guys at every meeting, refer them to me for urgent health issues if there are any, or select them to meet our social worker or refer them on to other programs for housing and other supports. We have a clinical counselor who drops in on a volunteer basis to help the guys one-on-one, and he also does some interesting group work with the guys. And then usually I'm helping to facilitate the men's health discussion, which is kind of the meat of the program, while we eat dinner. And the guys tell me what kind of topic they want to discuss, and over the course of 4 years now, we've pretty much covered every major topic a medical school curriculum would cover about how the body works. And the guys have asked over the years some amazing questions, and a lot of it is fertilized by peer support and peer learning. So I just sit back and make sure they're not telling complete falsehoods and support them to make sure that they're heading in the right direction. Some of these guys are expert patients. They've lived their experience for years, and they can teach each other way more than I can with our invited guests. So we definitely let that happen. And then we have a closing by Henry Charles again, where all the guys stand in a circle. It was pictured at the beginning. Put your hands on the shoulder of the guy next to you, and Henry speaks in his traditional language. Thanks for the food and for the attendance in the evening. So it's a really nice way to close the meeting. And as you can see, our statistics for attendance, in the first year, we were stumbling along as any program does in developing organically. We had about 20 to 30 men attend, and it quickly went up to about 40. And then after that, you can see we plateaued because we actually reached the saturation level of the room space. So we've been able to retain basically a maximum attendance since 2012. And as you can tell, it works. So this is a picture of our guys right before the health fair. These are the volunteers who helped out with those 130 guys that day. And over the years, we've generated quite a bit of interest in the Aboriginal health community in Canada, and of course across British Columbia, and that's what brought us to partner with the Movember Project as an example of an innovative model to engage this population. So where we meet Movember is with this three-phase project. First, to focus on a rigorous program evaluation of the Dudes Club in Vancouver, which we haven't yet had the resources to do to date. We had done some informal evaluation with the guys, but nothing this rigorous. Where we developed an evaluation survey, focus groups, of course, and in-depth interviews with providers and some of the guys. Phase 2, which we're well into now, is to establish pilot sites in northern British Columbia, in rural and remote areas where we had connections, and guys in community program providers were really keen to bring this model to their space. So again, evaluating that with focus groups and interviews as we pilot the model. And in phase 3, to develop an online toolkit that I think you'll hear a lot more from in terms of that model from Corey's program. We're still in the very preliminary stages of that, but an opportunity for other communities in Canada, specifically First Nations communities, to adopt this model to their setting with a helpful interactive online toolkit. So to give you guys an idea of the pilot sites we've set up in British Columbia, at the very bottom of the Google map, you can see the distance between Seattle and Portland, which is about 5 hours on the road. If we were to drive from our site in Vancouver all the way up to Morristown, it's almost 23 hours. So it's a big distance in British Columbia. And we have sites in Prince George, Smithers, and actually on a reserve in Morristown, which is not an easy thing to set up because of the jurisdictional differences and just the ways of doing things on reserve. We're very fortunate that they were willing to partner with us. And overlap that with the map of the First Nations territories in British Columbia. So at the very bottom, you won't see the type, but it's the Coast Salish community where we're at in Vancouver. And then up in the middle part where Prince George is, that's Clanatini territory, and then right beside is Wet'suwet'en. So those are the traditional territories that we're working in. So moving on now to the results of our project. This survey that we've developed is actually trying to distill 4 years of program experience into a 5-page survey using a logic model. So for those of you who are interested in community program development or evaluation, the logic model is a very rigorous way of assessing the impacts of the program and trying to have an iterative feedback model for improvement. And so these are the results of that survey, but I'm happy to share with you our process with the logic model if you'd like. So the average age of the guys who attend the Dudes Club is around 46. 77% of the men are over the age of 40. So you can see you're asking questions about young men. This is definitely an issue we're facing. Unemployment is very high in our guys. And interestingly, for family status, as you can tell, very few of the men are currently married, but over half of them have children, of whom very few live with these men. So this is a story of estrangement from family and of isolation, which compounds a lot of issues you can imagine in that community around fatherhood, around family dynamics that they've grown up in. So it's a difficult topic for us to discuss, but we talk about it openly with the guys. And then to give you a sense of the demographics in more depth, so this is the ethnic breakdown. Almost 2/3 of our men are First Nations, and the remainder is Caucasian and other ethnicities. And then to give you an idea of the housing status of our men, an SRO in Vancouver is a single-room occupancy hotel. So you can imagine the nastiest cockroach-infested hotel is an SRO. Very few of the rooms have a bathroom. They all have a little cooktop, if you're lucky, and a space to put a bed. And the bathrooms are shared. And it's subhuman living, to be honest, but that's a big part of how people live in that community. And then if you add BC housing, which is a little bit better, but some of the BC housing buildings are actually quite poor quality as well, to shelters, that total is almost 2/3 of people living in rather unstable housing situations. So to give you guys an idea of satisfaction, we developed this survey. Of course, that there's no validated tool to assess how these programs work with this population, so we're starting from scratch. But as you can tell, 97% of the guys are either satisfied or very satisfied with the model. And 77% of the men, this was we were very happy to see, feel safe in this environment to connect and share around their health issues. 93% of the men feel that the health presentations are either helpful or very helpful to them. And almost 60% of them rated 5 on 5 for the Dudes Club helps me deal with health issues with more confidence, and the Dudes Club improves my quality of life. So those were really nice things to see. Some of the statistical analysis so far, these stats are based on 97 respondents, so we're now up to about 130, but for the presentation we did stats on 97. And when we start to look at the trend, we can see some really interesting things that we were hoping to find from the get-go. So for the men who attend more consistently, we wanted to see if there were impacts of regular attendance and retention. And there certainly are. So in terms of quality of life, the Dudes Club supports their spiritual wellness, and that they receive, as a result of the program, health gains revolving around their confidence and ability to access health issues in a proactive way. All of those across the board are statistically significant differences with men who attend less often. So that's really nice to see. And in particular, with our men who, with our focus on Indigenous men, on First Nation men, there is a statistically significant difference with them compared to the other ethnicities in terms of trust, which is hard to come by in a community where many of the men have been heavily traumatized and abused, and feelings of ownership, having their voice mean something, that they feel uplifted, a positive outlook on their health when they leave the meetings. And in terms of peer support and empowerment and solidarity, all of those factors seem to be emerging as differences with the other ethnic groups in the program, which is nice to see, because in a way it is their space, so they feel safe to engage there. And for some of you who are familiar with North American First Nations or Indigenous approaches to health, this is at least 5,000 years old in medicine field. So the balance between mental, emotional, and physical, spiritual dimensions of health. And in there we've tried to embed some of the themes that have come out of the qualitative work so far from the focus groups. So 2 of the focus groups in Vancouver and 1 up north in Smithers so far that we've been able to analyze. So I'll read for you some of them. So a sense of purpose, brotherhood, a therapeutic sanctuary, a feeling of agency, an opportunity to reconnect with culture, and of course, peer support and self-care. So those are some of the themes that are emerging so far. And we did this with the guys years ago, actually, before we went to present at a World AIDS Conference in 2012. And we created a word cloud for the words that represent the group the most. And now we come back to it in a more rigorous research setting and find the same themes are still very strong for them. So I'll read for you a couple of quotes before I close with a short video. So these are quotes from our focus groups. I'm an addict. You got me away from my addiction. You just did me a big favor. If I'm here, I'm not in the addiction. I'm here. That's another thing. A lot of people feel isolated here. It makes them feel like a part of something, like a part of a group. You're all alone. That's what drives people into addictions. It will drive them into depression. It will drive them into suicide. Before I used to not be able to just talk in a group, the anxieties in that, I got to know the people. I was able to trust them and open up a lot more, because people were consistent in coming. This is a very, very important thing. Consistency for men who don't access health in a very comfortable way. Same face at the same day every time. That's super important. And in a lot of ways, it saved me too, like from depression. And at the time, I was grieving. So in a lot of ways, I returned to life too. Only men understand men and what they go through. So I'd like to acknowledge our research team. And especially our elders, Sandy Lambert and Henry Charles, and the elders of the pilot sites. And of course, all of the dudes with whom this would be absolutely impossible. And dudes actually stands initially for Downtown Urban Nights displaying equality and solidarity. One of the guys developed that acronym. I'll take some questions after the video.
This is a place where I don't feel alone. This is a place where I feel at home.
questions?
Sorry, I'll let you. I have just two questions actually. So one is that you said that the capacity of the group is about 40 people, and now you have surveys from 100 folks, so there must be some turnover.
Absolutely.
And how does it look like? How people come in?
Yeah, we're trying to assess the retention in a way. It is a very transient community. But when we look at the number of years people have lived there, 2/3 of the men have lived there at least 5 years. So there are a resident group of men who live in the downtown east side, some of them for 30 years. But there's also a group of men who rotate through, and so that gives us an ability to spread the data for those who attend often and those who attend less often. Sorry. I think it was about 50% of the men said they attend at least most of the time. So we don't have too many guys who come once and never come back. But because of their life situation, may come a few times a year, may come every meeting. When I look out in the room, there's probably half the guys, I know their faces for sure. And oftentimes it's 80%. But there's this group of 30 guys who never miss a meeting. So that's kind of the spread, where 65 or so attend. We have a core group of 50 at least who come to every meeting, and then the other 50% are spread out. But very few guys come once and never again.
I know you said it's somewhat pilot based, but I imagine it might be a challenge to get a room that many people together in smaller places. Do you have a sense of what the census is up in the smaller places?
Yeah. So they've been keeping stats so far. The room space also has a limitation. We were going to partner in Vancouver with a place called First United Church that does a lot of it's a shelter, but it does a lot of meals, of course, for the community. It's a space actually about this size, but it's hard to engage. We would easily have 200 guys at the meeting, mostly for the sake of the food and maybe the solidarity. And that would be hard to do health programming with that group. So I think we've really reached the limit of what is possible in terms of active participation. But in Smithers so far, they have about 10 guys attending each meeting. And that's kind of their cohort. It's a small town. And in Prince George, it's the so-called hub of the north, where they have about 20 guys attending the meeting on a good day. And in Morristown, they're still kind of rolling along, so they only have 5 or 6 guys attending so far. Anything else?
I switched now to my presentation. You want to get up and move around and do some jumping jacks? It's chilly here today.
We have some shameless swag from November here. So I'll just hand it out while Corey comes to the presentation. They're screwdrivers. 7 bits.
So, as Paul's handing these out, I'll start into my presentation. So, as John mentioned at the outset of the presentation, Unmet Suppression and Suicide Network tries to cast a wide net to look at various ways of reaching a variety of men in the community. So you heard us talk about a program aimed at providing men in general who are suffering from depression, suicide, with mental health literacy. We heard Paul talk about a program aimed at Aboriginal men and men in challenging environmental situations. And what I'm going to speak to you about is an intervention that's aimed at older men. So the topic of this presentation is about promoting and developing a toolkit for disseminating men sheds. And before I start, just by show of hands, who has heard of men sheds before? Anybody? It's not a program that is well known in the U.S. at the moment, but hopefully interventions, presentations like this will begin to change that. So this is just a quick mention that the work that I'm going to be speaking to you about is done as a part of the team, including at the bottom of the slide, Doug Mackey, who's our community partner on this project, who's the
So as a bit of background, this is a slide just to emphasize the point that there, as we all know, are huge disparities between the number of individuals in our communities who experience mental health problems and the number of individuals who receive help for those problems. So this mental health service gap is a significant issue that receives lots of attention at a conference like this. But importantly, that gap is especially large for certain groups. As we already heard from John, that gap is certainly wide and large for men in general. It's also wide and large for older adults. So in terms of individuals in the community who have mental health problems and who are not seeking professional mental health services, older adults have the largest unmet need. So if we look at older men as a particular subgroup of the population with particular unmet mental health needs, we need to look at innovative ways to reach out to those guys to help them. And this is just to sort of bring home that point a little further. This is a study we published a couple of years ago looking at disorder-specific mental health service use. And one of the conclusions from that study is that men and older adults and individuals with certain mental health problems are particularly unlikely to seek services. So this is not a unique problem that our study found. It's a consistent finding in the literature. So what are some of the problems? What are some of the reasons why older men may be particularly unlikely to seek help when they need it? So this is I like this image of an older, dirty Harry. Sort of captures, I think, a sense of what some of the significant problems are for older men who are suffering from depression, suicidal ideation. It's really this idea that the real man is somebody who is autonomous, who's independent, emotionally detached, tough. So if you're this kind of man, or this is your sense of what you should be in the world, then you're probably very unlikely to seek help if you need it. And the other issue facing older men is that there's a striking lack of community programming out there for older men in particular. So there's lots of community programs in Canada, I'm sure the same is true here in the US, for kind of mixed gender individuals, community programming for individuals who want to go attend some information sessions or ongoing community support, but there aren't very many programs in the community aimed at men and older men in particular. So these two things together represent a problem for older men. They don't want to seek help if they're struggling from depression, suicide, and if they do want to seek help, maybe it's not from mental health professionals, maybe it's from someplace in the community. Those supports just aren't really out there at the moment. So a potential solution to this that emerged in Australia is something called men's sheds. So this, the men's sheds model is a really interesting one. It emerged in the late 70s in Australia. And sort of sputtered along until the first official shed opened in 1998. And since that time, in a relatively short amount of time, the men's sheds movement in Australia has exploded, so that there are currently over 1,000 sheds in Australia. So these programs are grassroots, sort of bottom-up programs that are started by men for men, with the purpose of reducing isolation, connecting men, and it's especially targeted at men who are at risk of isolation, so men who are retired, who are perhaps unemployed, and isolated for other reasons. And the idea is to connect guys, to enhance their knowledge, skills, social support, through traditional male-oriented activities, the kind of activities that are likely to appeal to older men who ascribe to this traditional male masculine ideal. And like I said, Australia has a huge men's shed movement. There's probably second at the moment is the Ireland men's sheds movement, which I believe at the current time has about 300 sheds, and I've heard that there are about 5 new sheds opening in Ireland every week at the moment. And we are interested in bringing this movement to Canada. So the goal of our program is to support the development of men's sheds in Canada, or to support the infrastructure for men who are interested in starting a shed by developing a toolkit for them to guide the process of starting a shed. The idea was to begin in year one to develop the toolkit. In year two, the idea was to roll it out as a pilot to groups who were starting sheds to get their feedback, to revise it, to improve it, with the end goal of developing a national Canadian men's sheds network that would house the toolkit and also connect men who are interested in building this kind of thing. So one of the questions is why develop a toolkit? Especially because there's already a toolkit that exists. So this is a screenshot from the Australian Men's Sheds Association. And as you can see, anybody can go onto this website. You can download the Australian Men's Sheds Association Interactive Toolkit. So this exists, why do we need to do it? The argument is that there are different cultural contexts and different environmental contexts. Our team is located in Winnipeg, Manitoba, which has snow on the ground for 4.5, 5 months of the year. A little bit different from what happens in most parts of Australia. So there are environmental differences, there are cultural differences that we're interested in supporting in terms of men, Canadian men, learning how to start a shed. And again, it's important to mention that these sheds are not top-down, organization-driven sheds. They are really started by a couple of men getting together, deciding that they want to start a shed, and wondering how to do that. So the idea with our project is to provide some support and help to those guys who are thinking about doing this or who are struggling to do it. And in terms of how we did this, we wanted to borrow knowledge and experience from members of Canada's first men's shed, which is the Woodhaven Men's Shed in Winnipeg, Manitoba. That's a shed that has about 50 members at the moment. It started 4 years ago, so that's a shed that's gone through a number of trials and tribulations in terms of figuring out things that are working and aren't working for men who are looking to start and grow a shed. So we've had some focus groups with those individuals. We had focus groups with guys who knew nothing about men's sheds, guys in the community who wanted to get their thoughts on what they thought about this idea, what they thought about the name, what they thought about the possibility of starting a shed. And then we also wanted to hear from men from a diverse background. So we did consultation groups with a group of rural men, a group of men who meet in a local coffee shop every week, men from the lesbian, gay, bisexual, transgender, queer community, Aboriginal men, and men who are newly immigrated to Canada. So we also wanted to hear about from these individuals, is the men's sheds idea, concept, something that they would be attracted to or not? So we wanted to hear that. This is just to say that we've run a number of focus groups, again, with individuals from the Woodhaven Men's Shed in Winnipeg and individuals that we recruited from the community. We ran those focus groups over 3 time periods where we got input at various points on various aspects of developing a shed, keeping a shed running and growing it. So in the end, we have a number of individuals from focus groups representing, we think, and importantly, a diverse sort of swath of older men community. Now, I should mention, and John mentioned this already, that our November-funded Men's Depression and Suicide Network project is a 3-year project, and we are just in the first third of the 2nd year of the project. So the work that we're presenting on today is preliminary, and hopefully we'll be able to come back in a year or so and provide some data on how these things work out when they're finished. So what I'm going to be talking about is really a very preliminary toolkit that we put together. And again, as I'll mention in a second, that toolkit is currently in the pilot test stage. So this is what it looks like. There's an introduction to what men's sheds are exactly, and that's important. Men's sheds, it's not one thing. So each shed has its own sort of unique personality. In Australia, some of these sheds are very sort of focused on one thing. There might be a shed that's devoted to repairing bicycles, or there might be a shed that just focuses on woodworking. There's other sheds that do a number of things, have a number of different activities. So each shed has a kind of a unique personality. So we wanted to introduce people who are interested in this idea to the idea of men sheds and what it could be. There's a section on the benefits of joining a shed, on how to start a shed in terms of finding a group of guys, finding a space to meet, deciding what you want to do, what your shed's going to have in terms of activities, and deciding on what the vision is for your shed. The guys that we spoke to are concerned about funding. These are grassroots organizations that don't have funding, so they need some source of income to rent space or to do activities that they're interested in. And it's not just about starting a shed, but it's also about maintaining and sustaining it. And there's a lot of attention to how you want to market this idea. How do you want to advertise what you're doing to recruit other individuals in the community? And there's a section on links and resources. So what I want to do just fairly briefly is share some of the qualitative findings that we heard from the focus groups that we're incorporating into the toolkit. So some of the benefits of getting together, and importantly, I should mention this too, because we're talking about, John mentioned sort of a range of options for supporting men with depression and suicide. This is not an intervention. This is not a mental health intervention. This is a community support group. And there are going to be individuals in the community, older men, who aren't struggling whatsoever with depression and suicide. But there's also going to be a group of guys who are isolated and who are lonely or are suffering from depression, who aren't willing to go talk to a mental health professional, but will be willing to hopefully engage in something like this. So the benefits of getting together, one man said, I'm a writer, so I always need the space alone. But if you don't get stimulation of being with others, the community thing, you can get depressed. Another guy said, I lost my leg 6 years ago, I was stuck in my room until I got brave enough to come to places like this where you feel safe. And again, that safety message is something that we hear a lot in men's sheds, and that Paul talked about as being important in the Dudes Club. The importance of having a welcoming space. This was an interesting thing we heard from a lot of the men in the focus group. This idea that men aren't welcoming. So this is one quote. If you take a club that's been going for 4 or 5 years, come alone, forget it. Another man said that's the first thing that goes through your mind when you walk in the door. What are these guys going to think of me? So this concern about being judged, this concern about are you going to be welcomed into a new group, into a new space with existing members, is a concern that prevents a lot of men from kind of stepping in the door in the first place and looking at ways to sort of reduce those barriers. Finding a group of guys, this is an interesting quote. One man said, when I was 20, it was like, you like the color blue? So do I, let's be pals. But when you're older, you want to establish networks, so you may find yourself needing something like this. The idea of connecting as being important, but also potentially harder as you get older. Deciding what to do. Again, this is the idea that each shed will have an activity, one or perhaps a number of activities, and one man's in a group in a different area may have distinctly different interests, and that's certainly the model that we're seeing emerge in other parts of the world. The shed in Woodhaven has a number of activities. There's a men's cooking club, they do carving, they have a number of guys who get together to play crib and other card games. There's a meet and greet coffee session, so there's a number of different things that happen in that shed, some of which appeal to everybody, some of which appeal to a select group of men. So the idea there is a little bit of something for everyone. Funding. So this is this idea, and these tend to be relatively poor organizations. They don't have a source of funding, so they need to cobble together money in small ways to try to keep their organizations running if they need to. So one of the guys said, we'll be there advertising our membership, at the same time selling a few goodies to make a few bucks. So what they'll do sometimes is they have, these guys will do some carving, and then they'll go to a farmer's market and sell their carvings, and that money will go back into the shed. They're also looking at ways to try to get money from government, from local government, from provincial government. That's proven to be a difficult task, but we're looking at trying to find ways to support men in doing that. And this idea of how you kind of grow your shed, how do you explain what it is you're doing? How do you tell people what a men's shed is? Well, it really has to do with marketing and branding. So what you'll see at the bottom of this slide are a number of different logos from different sheds internationally. And some of them, you'll see the logos kind of have different messages they send. And some of these, like for example, this is the Shed Manitoba logo, which is a hammer superimposed over a Canadian maple leaf. Some of these images are very sort of focused on kind of building things and working with tools. But one of the guys in our focus group says, I'm not mechanically inclined. Give me a hammer and I'll probably whack my thumb. So this idea that if you market your shed in this way, for example, this image on the top right, that is going to drive away someone who might otherwise be really interested in getting support, joining with this. So we're really paying close attention to the idea of how you brand and how you market these things in a way that's going to attract and communicate these kinds of supports. So right now, as I mentioned, we're in the second year of our 3-year project. So we've developed this preliminary toolkit. And the idea now is to get it in the hands of groups that are starting sheds, to get their input, to revise the toolkit, to improve it. So we have 4 primary pilot sites that we're working with in sort of rural BC, in rural Alberta, in Halifax, and in Ontario, so sort of coast to coast in Canada. And what we're doing is we're meeting, we've given those groups our toolkit and had a preliminary interview with them to find out what their needs are, what they're looking for. We're going to be meeting with them this summer for a sort of midpoint check-in, and then in the fall for our final review where they're going to give us their feedback on the toolkit. We're going to incorporate it and make changes and improvements. There are also 5 private secondary sites. These are also groups that are in the process of starting sheds. So the men's sheds movement in Canada is it's at a really interesting critical point. It's really kind of growing right now. So we're in at the right time, I think. We're in at sort of the groundswell. And remember, Canada's mission is really to spread the word. The idea here is to build capacity to provide support as wide as possible for men to engage in projects like men's sheds. So our second year pilot is really giving us an opportunity to connect with men right across Canada to let them know what we're doing and get them involved. And as I mentioned, the final endpoint for us, the third year, is to develop a website that will. So if you type in men's sheds into Google, you'll find the Australian Men's Sheds Association, the New Zealand Men's Sheds Association. Those are websites that are in existence that are connecting men in those countries who are interested in starting a shed. So we want to do the same thing in Canada. So our website will not only connect men, but provide tools and resources for men who are interested in starting sheds. And in response to one of the questions I asked earlier, there's also going to be a blog on the website, an opportunity for men to sort of talk to one another if they're interested in starting a shed, perhaps discuss issues with men who have already established sheds to get their input, to get their feedback, to get their help. And we also want to connect our shed movement with the international shed movement so that Canada is part of this movement, and hopefully we'll see some movement in terms of and some uptake in the U.S. perhaps. So again, just to kind of wrap up, our final objective is to develop a resource for supporting older men's well-being. The idea here is, we hear this a lot, the idea is health by stealth. So this is an idea where we want to support older men who might not otherwise explicitly say they need to seek help for depression, for thoughts of suicide, but really use that help. So this is an informal, community-based prevention initiative that we think is really important for older men. We're thinking about this as a supplement to formal mental health services for older, depressed, and suicidal men. But it might be the sole form of help for depressed or suicidal older men who are otherwise unwilling to seek professional help, perhaps because of this, again, describing to the masculine ideal or other reasons. So thanks for your attention. Again, there's my contact information, where any one of us are happy to speak to or to be in contact with anyone who has questions about the conference. So thank you. Anyone have any questions before we transition to the last presentation here? Second last story. Yes.
I guess I have a question on the last one. Considering how to help ourselves approach, especially around some of the questions. I feel like there's a difficulty maybe by providing something that might actually stop people from getting formal help because they think they're getting treated. Or do you feel like there's some ethical issues that you handle people who are severely distressed in a model that may not be set up to provide everything they might need?
Yeah, thanks. But let me repeat the question. You didn't hear it. So the question is, with this help by stealth model, might individuals who need more intense interventions not get those interventions because they'll take advantage of this and have not take the extra step and move on to professional help? What we know from the health literature is that it's probably not the case that individuals who are really suffering from severe depression, anxiety, or mental health problems, they usually start by trying to solve those problems themselves. Then if that doesn't work, they ramp up to talking to family and friends. If that doesn't work, it's kind of a step care model where people are kind of ramping up their efforts, and if those work, that's great. If they don't, then they'll take the next step up. So we really hope that this kind of intervention will be a place where guys can come and discuss mental health problems in a very sort of supportive, informal way. And then if they're not getting help, that hopefully, and we're seeing some evidence of this, is a place where those guys will get advice to take the next step and connect to professionals and communities. At least that's the hope. It's a good question, but what we know from the health literature is that it's likely going to be supporting, not preventing them in the next step. Thanks.
Good morning. I'm going to be actually talking about 3 programs. One for men in the military, and it's not the focus of our work with the Movember Project, but the Movember Project actually helped us move from working with the military to men who are civilians, men with prostate cancer and young men with mild to moderate depression. Marv Westwood and I have been involved with working with men in the military since the mid-1990s. Men in transition from military to civilian life. We've also worked with police officers and corrections officers using this similar program. And what we decided and what this project made possible was for us to not work only in our own province, but also to move across Canada and do some work with our colleagues at McGill in Montreal and at Acadia in Nova Scotia. So I'm going to tell you about the Veterans Transition Program. We've done some considerable amount of research around it through my colleague Dan Cox at the University of British Columbia. And I'll explain this program, and we'll, just like the rest of them, are in year 2 of our program working with men with prostate cancer and young men with depression. And you'll understand how it is we've decided to use the principles and practices of this program and apply it to more populations. And primarily what we're doing with working with men in the military, initially in the 1990s, Canada hadn't joined other countries, the United States, and working in Afghanistan, so we were working primarily with peacekeepers as well as survivors of the Second World War and some Korean, and the Korean War. But in the last 5 to 10 years, we've been focusing primarily on the young men returning from Afghanistan. And what we found is that there were reductions in depression and increased self-esteem. But we also found that a number of them, many of them actually had traumas that preceded their military experience. So the program with the military is a very intense program. It's a 10-day residential program where we work with the men for 4 days. We stay with them 4 days on, 4 weeks off, 4 days on, 4 weeks off, and 2 days. And it has several components. Again, as has been mentioned by several of the others, the essence of safety is essential. And we actually had to earn our right to participate because neither Marv or I had military experience. But after working with hundreds of men, we've come to learn the language, we've come to learn and understand what the process of becoming or joining the military is all about. It's very complex. And And so the first day or two, and usually we can accomplish safety within hours. And the biggest challenge, and I'll probably say this more than once, is recruitment. And we found that to be true also with men with prostate cancer and young men with depression. So one of the biggest or easiest ways of getting men there is saying, I know you don't need help, but your buddy does. And if you come, your buddy will likely come as well. So when we start the group, we often start, well, so none of you needed to be here, but now that you're all here, let's get started. And within a short period of time, they begin to appreciate and recognize that the program can actually serve them as well. And they have termed our work as dropping the baggage. So we don't shy away from going into the darkness of war experience, the darkness of what it means to see your buddies blown apart, what it means to kill people. And so we go into their stories and work with them in terms of coming out the other side. We also look at transferable skills. We've worked with a Institute of Technology to match the skills that they gained in the military, but they didn't get the proper courses. They didn't get 101 of anything. So the BCIT, the British Columbia Institute of Technology, has actually matched those skills. So some of them get college and university credits, so they feel actually that their experience is being more credible, and they can then continue with perhaps a year, their introductory year is given to them. They can be seen then as second and third year students when they start. And we then also work with them in developing goals, career goals, relationship goals, and also we do assessments of what do they need with regard to their experience in the military and some of the unfinished business that still exists. So just in terms of information, we have had a wide variety of participation. Army, Navy, Air Force, all of the people that are participating have had a traumatic life event. Just under 75% of them have been deployed to war zones. And what changes have we seen? 64% of the veterans had low hope, had high hope by the time the program was done. There is an increase in self-confidence in their career transition. Increased career-related optimism. An awareness of, an increased awareness of job market trends and opportunities. Increased career-related social support, an improved work-life balance. And what about their emotional distress? We found a marked reduction in depressive symptoms. 39% of them, the participants over the years who were depressed are not depressed after the 10-day program, and follow-up 3 months later, the results were consistent. And also some movement from severe depression to mild or no depression in another group. A reduction in PTSD, symptoms thereof, and in negative self-beliefs, in anxiety. And one of our features of the program is that we've had over 500 participants. We've only had 2 dropouts, and touch wood, we haven't had any suicides. We've had members who are suicidal. One of the strongest features of the program is that we work on developing community. So we've used Judith Herman's model in terms of trauma, where she talks about prevention and intervention are the same. That if you can keep people in community, their likelihood of PTSD is less. It's true also of depression. And if people have PTSD or depression, if you can bring them back into community. So what we've learned is that the men care for men, and it's with the program with the military, it's soldiers helping soldiers. So they'll take care of each other, even though they haven't served together. By the time they're in this group together, it's like they're back in the troops. And we actually have rented a space that we run this program in. It's a lot like the barracks. So you have a wall of urinals, you have a wall of sinks. They're all in very simple rooms. It's very basic food service, and they very quickly adapt to that identity of working together as a troop again. And so they take care of each other. If any of the men after the 10-day program are suicidal, they will call each other, and they will then connect with us as necessary to say we need help. Can you connect us to other professionals so that our buddies don't kill themselves? So it's been a highly successful program. It took us about a decade. Marv and I were doing this off the side of our desks and running these groups periodically every year. And it took us about 10 years to design the program. And then for the last 5 years, we've been then looking at evaluation and measurement. And so what we found is that their relationships improve, careers improve. They go back to school, they get different jobs. Often when we met these fellows, these men are often in their mid-20s to their early 30s, a lot of trouble with alcohol, a lot of trouble keeping jobs. We had one fellow who slept under his bed because he kept on beating up his girlfriend because of the terror, the nightmares, not uncommon. So they're just struggling for the transition back into civilian life, feel very misunderstood. And so the program has been highly effective, so much so that it's now funded in part by the federal government, and we also now run programs across Canada. So we had started asking the question, could this transition program serve other men? So the funding through November came at an opportune time for us. And what we then looked at, though, the work that we're doing with both populations, the men with prostate cancer as well as the young men, are pilot projects. So we learned very quickly, for example, that the men who had prostate cancer, as we began to talk with them and were working on recruitment, they made it very clear to me. And I'm working more closely with the prostate cancer group, and Marv is working more closely with the university-aged men with mild to moderate depression. And it didn't take me long to learn that there's absolutely no way any of us are coming to a 10-day program. So we modified it and decided, because we run our first group with the university guys at 2 3-day programs, a 6-day program, we said, what about a 6-day program? They said, we're not even going to do that. At best, we'll come to a 3-day program. So what we've done is we've modified it to, it's a program in evolution. We've taken their recommendations very seriously and tried to accommodate their needs and their expectations and requests from us as we run the programs. But again, we've tried to put this into the context of understanding men, their resistance to asking for help, their desire to be independent, and so we've worked to also accommodate them in terms of what we know about men from the literature and from our other experience. The other part of this is that the languaging is hugely important. When we work with the men in the military, I often don't let them know I'm a physician because they have a real distaste for medical services. For some of them, it was career suicide. To admit that there was a psychological or mental issue would mean because their charts were open. So, and you don't have to give a lot of information, so that if a senior member of the military phones the physician and says, what about Charlie? The 10-second pause gives the answer. So they really had a resistance to my presence until I earned my right to be there as one of them. And the fact that many of them needed medical help and were resistant to asking for that, quite apart from their PTSD. We also, in that program, we ran a training program for primary care physicians run by the members of the military to teach primary care physicians about how to talk to them, how to ask questions, how to provide service for them, how to explain to them that this was different from the military and that there was actually confidentiality here. So we've taken all of those same principles of shyness, resistance, independence, and applied them now also to the next two populations. And the interventions that our work is based on are these two components. So we begin with a very, very basic life review. It's based on work done by Bjorn and Deutschman, who have actually 11 themes. We have reduced it to 2 or 3 themes where we invite men to tell their story. And we also know from, I think it was Pennebaker, who did a study on the value of writing. So we get these guys to write their stories. For both of the populations we're working with now, we give them 2 pages. We get them to write in a group because we also know that when people are writing or doing doing some of this work, they are more likely to finish a writing task if they're in the presence of other people writing. So we will create a space for them all to spend some time on self-reflection and writing about their experience prior to military, prior to prostate cancer, prior to their depression as university students. And then what we do is we create the safety for these people to begin, for the men to begin to tell their stories. With regard to therapeutic enactment, it's a complex exposure therapy where we actually enact and reenact the trauma that they've experienced, but we usher them through the process in great detail, in a great sense of safety, with a different outcome. So they have a sense of mastery, they have a sense of actually controlling the situation. Very briefly, if you've seen your buddy blown up, often there's a sense of guilt, it should have been me. So in this enactment, we would get them to talk to that person. Then we'd get that person to talk to them about saying, if you don't keep on living, we both die. And it's more complex than that, but we work with them, and they like the action. So as soon as we work in a group, we put them in a circle, and once they're telling their story, we get them to walk. So they're telling their story as they move through some of their trauma. And we understand that often we know, for example, that trauma comes in through the senses, through the amygdala, and through the midbrain. So what we use all of that, both with regard to their grounding and their memories, and we're using the same methods with regard to the next two populations. We've run one group with the young men in university, and it's amazing how many of them have also had some traumatic event in their lives that actually stops them from moving forward and moves them into isolation, or keeps them in isolation. So the men with prostate cancer, we've essentially finished that project. We haven't analyzed all the data. And so we did run programs, as I said, in 3 provinces. And again, our goal is to have men help men and to explore the experiences of their lives. So there's 2 components to it. One is looking at their lives prior to prostate cancer, and then to looking at it after the diagnosis and the treatment of prostate cancer. We've been very amazed at the responses of these men. Depression is certainly there. The literature would inform us that the suicide rate of men with prostate cancer is also increasing. And we've had men who, one of them actually told us at the end of the group that had he not participated, he would have killed himself. He had a motorcycle, he knew exactly which road to drive on, he knew the curve, the speed, and he knew that if he killed himself that way, his wife would still get his life insurance, because he really felt that his life was over. So, and I'm actually going to end this presentation with a letter I got from him the morning I left Vancouver to come here. And what we've learned from these men, something we've called iatrogenic suffering, iatrogenic healthcare. It comes from another study that I was conducted in. The way the doctor talked to me caused me more pain than the pain from the disease itself. And what we've also learned for the men with prostate cancer, the way healthcare providers talk to us is more painful for us than the disease experience. So, and many of them feel that, we excused the urologist because everybody told us he was the best surgeon, but he had a horrible bedside manner. But what we realize is that they're stuck. They're left with the bedside manner of information that was incomplete, information that was given to them in a glib way. So it's a very significant outcome, and it will manifest itself as we do more and more of the assessment of the data that we've received from them. Then the second group of men, we've done one group, and we're about to, in 2 weeks, we'll run our first group out of British Columbia, in Quebec, and then in Nova Scotia. And again, we're looking for transformative experiences. We're looking for a sense of community. And with the young men, it has a lot to do with intimate relationships. In the first group that we ran, one of the men who was in his early 30s, at one point he said, I'm in this new relationship, and I want to do this differently. I know how to get her into bed, but I don't really know how to talk to her. And can you help me with that? And I said, why don't we talk about this at lunchtime? So there was a stairwell, and it was a beautiful sunny day, so he said, I just need to learn how to talk to a woman that I really care about. So I went to the bottom of the stairs and I said, so tell me, what's this been like for you? And, what's it like to actually have a conversation? And what's it like to begin to self-disclose? And how about using words to express your feelings rather than to, as you said, just get her into bed? And, we were talking about it for about 4 minutes, and I looked up, and the whole group was sitting at the top of the staircase, leaning forward. So I realized it's an important issue. They don't have anybody they can talk to honestly about their own fears of wanting to be different. So what we're learning in that population is that we want to just give them opportunity to talk amongst themselves, and also for us as the leaders to be very honest with them in responding to whatever questions they might ask. And again, it's the emphasis of all three programs. It's soldiers helping soldiers, it's students helping students, it's men helping men. And we also have started these programs with basic communication skills. We have a wheel of emotion, so that, as you know, basic emotions such as mad, sad, and glad, and we actually have words that describe emotions that might be more complex. And as they're talking, we'll give them the wheel and say, can you find the word on the wheel that could begin to give you some understanding or to help us understand what's going on inside of you? And for all three groups, it's been very, very effective at helping them understand that they need words to express what's going on inside of them. With the hope of greater self-respect and autonomy, increased self-confidence and assertiveness, and better communication skills. And the feedback we got was that men from the military is the communication skills are not only good for us in terms of jobs, they're good for us amongst ourselves, and they're good for us with our relationships. And in that program, we also had a program for spouses and partners. And with regard to the prostate cancer group, while we didn't have funding to work with spouses and partners, it was such a consistent message from all 5 groups that we ran. They almost, the first words they'd say to us, they'd say, well, this is about our partners, this is about our wives, this is about our spouses as much as it is about us. After the 3 days, they would say to us, we're glad that we didn't have our spouses or partners here, but we'd like something to be provided for them as well. So we have actually successfully raised additional funding, and we will run one group for spouses and partners in mid-June. So that the project for the men is finished. We're actually saying now the project in its entirety won't be done until we've run a similar group with the wives and partners, and we'll give them the same program in terms of pre-prostate, post-prostate, and the effect it had on them and their relationships. In terms of the active ingredients that they like is all the components that I've talked about. It's a group setting, it has a sense of safety. There's lots of tears shed. And the other part of this is whether it's working with men in the military, PTSD, prostate cancer, or young men, there's a huge component of grief that men are challenged to express or experience openly with regard to emotional expression, and we don't often refer to it as crying because that has negative connotations. We work with, you're just expressing something that's going on very deeply in yourself. And we work hard to keep the safety high so that they can process whatever it is they need to process. In terms of group setting, we've had an incredibly positive feedback, whether it's any one of those 3 populations. I'll just let you read. It was an incredible space for myself and other men to speak about issues. You get a completely different perspective with the group as it's a reality check of how people actually see you, and this changes you. Communication skills, as I alluded to, it strengthens their relationships not just amongst themselves, but with the people they care about. And it enhances their self-confidence. With both the young men with depression and the men in the military, we also work at career possibilities. We have worked with them on developing their curriculum vitae so they can actually go out and present that material to people for jobs. We've also invited people who are involved in human resources to teach them how to do interviews, and we practice the interviews with them. Made a big change. I get to know others a lot better, and they're more comfortable because I'm being more understanding. I can express a lot more fluidly now because not having my guard up allows the ability for me to feel more. With regard to the enactment, involves directly experiencing more positive and adaptive beliefs and behavior in simulated situations that may have originally caused negative beliefs and maladaptive relational patterns. And we work actually in multimodal lived experiences, and we take them back into that space and through it with a different ending. It was the most paramount and helpful part of the program, and takes such a weight off your shoulders of what's bottled up over the years, and you're forced to confront it. It allowed me to release the baggage I was carrying. It gives you the tools and roadmaps so the baggage doesn't come back to you to get you. My self-confidence is raised to a level that I've never experienced before, and it snowballs to different situations. I can talk to people in public now, and at work I'm more assertive for my needs and fairness. And in closing, this is the email I received Wednesday morning just before I caught the plane, and I sent an email very quickly, and I said, would you mind if I read your email? So this is from one of the first participants. This is actually from the man who was riding his motorcycle to his death, or planning to do that. It's as though he's addressing all of us. Dear friends, it is probably strange to be celebrating the first anniversary of a cancer diagnosis. It was 1 year today that I heard those devastating words, "You have aggressive prostate cancer." The journey has been incredible, but here I am, still alive and kicking, thanks to your counseling. The best news is that my mind has been totally free of depression for exactly 2 weeks today. In 1 short year, I've learned about cancer, radiation, hormone therapy, and depression. I am playing hockey with a group that I can keep up with, and I'm enjoying it more than ever. I tried playing with the young guns last Thursday. It's not half as much fun as I remembered it. My legs are still fatigued, but my upper body is stronger than ever. I thought chemical castration was the end of the world, but hey, not desiring sex all the time frees up about 95% of the male brain to become more productive. I will be getting my motorcycle out on Saturday, and I assure you that it will be for pleasure, not to cause pain. All of you should know that you make a difference in people's lives. Your work is much appreciated. Many thanks, and God bless. Thank you. Questions, comments?
Okay, thanks for staying till the bitter end. Welcome. I was thinking that being in this room is like making a transition from Miami to Canada because it's so cold, so I'm sitting here freezing, so thanks for staying. This last project is called Man Up Against Suicide, and I somehow forgot to include an acknowledgements and thank you slide and a conclusion slide. I don't know what that says about me, but I'm sure there's enough psychologists in the room who could make your own conclusions. So the inspiration for this project, as you've heard from others in the group, 4 to 5 suicides are accounted for by men. The dominant ideals of masculinity include stoicism and invulnerability and strength. We need more research on men's actual experience of depression and suicide. And this research needs to not only collect data, but intervene in the problem of depression and suicide. So we did this research project, and this is our website, which you can go to look at. So the goal of the research project was to collect data about men's suicidality and depression. And we collected this data from both men and women. So men who had experienced depression and suicide and had thought about suicide and maybe made attempts on their own lives, as well as men and women who had lost men to suicide. So as a sociologist, I feel the need to inject some social theory into this. So just briefly, we looked at this project from the social construction of masculinities approach, which you've also probably heard about from the other presenters. Essentially that men's depression and suicide rates are higher than women, not because of biological factors, because of social factors. So men's sense of manhood is constructed both socially and culturally through movies and in social institutions and all the other cultural factors, as well as what's going on in their own families, as well as what's going on in their local communities. So there's no one ideal of masculinity, but masculinity is created at the local and global and cultural levels. So our research, we thought it was innovative. So for those of you who may not have a sense of what photo voice is, it's part of a larger umbrella of what's called photo elicitation. And so photo elicitation is bringing in photos into the research conversation. And in that larger umbrella, it can be photos that researchers bring in for participants and researchers to talk about. They can be newspaper articles. They can be photos that participants take. And within that method is photo voice. And so the goal of photo voice is to give the lens to participants. And the purpose is to enrich the research conversations with the photos that participants take, but also then to bring those photos in the community to make change. So photo voice in this project, what we had was participants come in for an initial interview, so we talk about their experiences, and give them a camera and ask them to go out and take pictures of their experience of the journey of either losing a man to suicide or their own journey of making attempts or thinking about death or killing themselves, and then to bring those photos back into the process. So the power of photos is profound. It can get at emotions and not only contextual and actual factual realities, but also create images to talk about. So sometimes when you can't find the words for something, you can find a photo to talk about. So these are 3 photos that were taken, and the narratives were superimposed on top of them. Oh, so, thank you. And I actually read them. I can't, but I will look at them more closely afterwards. The first one said, "He is my son." This is a mother who lost their child. I will look more closely at them. I can't remember what the narratives are. So at the end of each interview, so we'd go through the photos with participants, and at the end of each interview, we'd ask them to select a few photos that they wanted to be exhibited in public exhibits, and to superimpose a narrative that they wanted to give the viewer context. And so far we've had 59 participants, and we've had 72 images that have been exhibited, and at 4 exhibitions in the past year. And we have one coming up in May. So, as I said before, we have 3 groups, and the first group of men, or first group that we interviewed, were men who had had direct experience of depression and suicide. And the second group were women who had lost a man to suicide, and the third group were men who lost another man to suicide. And for those of you who are data people, it's very small again, we had 7 men who had had direct experience of suicide, 13 who had indirect experience, and 29 women who had indirect experience. And as is typical, it's much easier to recruit women for research. Our population was largely Anglo-Canadian, and some rural, mostly urban people, and a good range. So while our population was fairly homogeneous in that it was mostly heterosexual, mostly Anglo-Canadian, we had a large age range, so from 20 all the way up to people in their 70s, and a large number of different relationships. So women who had lost sons or husbands and fathers, and men for the same. And we had a good balance of people who had actually made attempts on their own lives, and people who had just thought about it, and that we had different data from those 2 groups. So we just want to talk a little bit about some of the findings of our project. So this first group was men with direct experiences of suicide. And it's interesting, and I'll talk about this more a little bit in a few minutes, is that many of the men and women who had lost men to suicide talked about how it was out of the blue. They had no idea that their father or son or boyfriend was going to take their own life, and they would rack their brains to try to figure out, which sign did I miss? The men that we talked to who had direct experiences of suicide talked about this long journey towards that actual act or thinking about that act. Many of them had had traumatic childhood, long-term mental isolation, and that experience of, I tried to stop myself, I tried to go another path, and I tried to change relationships, so many attempts to kind of preserve their own life and sanity, and that culminated in an effort to take their own life. And we thought this really spoke to that, masculine ideal of keeping things quiet, of not wanting to let other people see that they're suffering, and not making connections with healthcare or with other people. We also found within this group that suicide, once they had gone down that road of suicidality, it was never closed to them. So many of them felt like they had to maintain very strict health regimes, or going to therapy or talking to other people to try and preserve their own life. But they always lived in that shadow. So that was a very common theme all through the 17 people that we interviewed. So this is a group of men who had lost men. There were 13 of them. And we found a real difference between men who had considered suicide or actually had made attempts, and men who had lost men. There was a very strong theme of rationality and cerebralness. So many of these men who had experienced depression in their own lives, however, they didn't really understand why their buddy or their father or brother had taken their own life. There was a strong attitude about, suicide is never the answer. I made it through. I just don't understand why this other person couldn't have talked or couldn't have helped themselves. So while there was some sadness and regret and the sense of the tragedy of the death, there was also a sense of judgment that he really made the wrong decision, which diverted quite strongly from the group who had actually taken their own or made attempts on their own life. There's a photo, kind of third from the top. A man took a picture of his son's suicide note. So his son was 17 when he died. And in the note, it was a very powerful, tragic death. Almost like one of the kids who was the golden boy of the town. Nobody ever would have expected something like this. He was an athlete, straight A's, and he wrote in his suicide note, I'm so sorry, Mom and Dad. It wasn't you. I had a fantastic childhood. I was just suffering so deeply for so long, and I just couldn't see the end of the road and how it might end positively, so I decided to hang myself in the shed. And the father spent much of the interview talking about why would he ever think that this was the answer. He said he had a good childhood. He said all these things. I just don't understand. So it was really trying to raise the thought of suicide back into the head and cerebrally, rather than going into what the pain of depression might be. And finally, women with indirect experiences of suicide. And it was interesting. We tried to, I don't know how many of you have had experience with grounded theory, but we tried to look at the interviews and see what was coming out of them. And eventually we ended up having to do a discourse analysis on the interviews, because there was such strong allegiance to feminine ideals within the women who lost men. So unlike men who had lost men, women felt powerfully guilty and powerful shame around the death of this man in their lives. And when it had come out of the blue, women talked about, I should have seen it. I should have been there. How did I not know? I failed as a mother, or I failed as a wife. If the suicide came as a result of a long mental illness that they had been a part of, and they may even have spent years trying to save the men from themselves, they still berated themselves at the end as to why couldn't I have saved him? And when it come, we call this group the end of a tragic life. So, the man had just tragedy after tragedy and then took his own life. The woman felt like I should have stuck by him. So very powerful example of the way that women hold themselves culpable for men's health, even more than men do as friends or within their own self. So that was very powerful. So I just want to end with going back to the methods of this project. One of the most powerful things about the methods is the ways of engaging community. So the goal of photo voice interviewing is to bring the conversation back to the community, to both change some of the policies around intervention and prevention of suicide in a way that's specifically sensitive to men's needs, but also to reduce the stigma of suicide by starting up conversations. Oop, this is going to go on its own. Okay. So, just want to say just a couple more things to introduce this video. We went to a small community in Rimbey, Alberta, and it's population 2,500. And the reason that we went to Rimbey was because a woman in one of our urban samples had her 16-year-old brother kill himself, and she said, you know, like the masculinity of the rural is something that you need to hear about because it's so much more, it's more emphasized and there's less services. And so it would be really great if you could come to my small hometown and talk to people and start a conversation. And the experience of going there was almost like the perfect example of community-based participatory research, not because of anything we did, but because the community embraced it. So the community recruited for themselves, so they got 13 people, men and women, to participate in the study. They took the pictures. I went and spent a week and a half in Rimbey, Alberta, which is an experience. Small town Alberta, so imagine like Midwest, tiny, from Vancouver, which was, yeah, totally different to me. I stuck out like a really big sore thumb. So they did that, and then we took the pictures, we went back home, developed them, put the narratives on top, went back to the community hall, and they hosted their own presentation. So in this is a woman who's playing the guitar. Her brother died by suicide, and another woman, Emma, who really spearheaded, and her brother had also died by suicide. So I wanted to show you the video. It's incredibly amateur. I sort of did it on an iPhone, and then one of our staff people turned it into a video. But we wanted to give you a sense of kind of this trip to Rimbey and how the photo voice can turn out. Hopefully the sound is loud enough.
Always
So we'd like to again thank Movember, who's our funder, and TBC. And I think that's the end of our presentation, but we really welcome any questions anyone had about any of the